Natasha from Western Wisconsin Health. I'm joined today by my fellow nutrition expert, Cheri Rott, our registered dietitian, and our endocrinologist, Dr. Lau. We're going to talk today about how to get more fruits and veggies in our diet and why should we try to do that. So starting off, Dr. Lau, can you tell us why eating 5 to 9 fruits and vegetables per day is beneficial to our health and to prevent chronic disease like diabetes?
Yeah, that's an excellent question. So I always want to start with like a little bit of my opinion with the modern Western diet. So the typical modern Western diet typically contain too much unnatural elements in the food. For example, there are a lot of processed meat, a lot of added refined carbohydrates such as refined refined starch, sugars, and often a lot of sodium, and a lot of trans fat as well. So all of these are known, and we really know this, that it contributes to chronic diseases such as cancers, heart failure, chronic kidney disease. It's not a coincidence that the rise of chronic diseases actually coincides with when the society start adopting this unhealthy modern diet. So what we should aim for instead is to start to replace all these unnatural sources of food with healthier choices. And fruit and vegetables are excellent choices. They have a lot of nutrients, fibers, which are severely lacking in our modern diet, a lot of minerals, and they have a lot of phytonutrients, which are basically antioxidants that help us combat all these chronic diseases such I mentioned earlier. So definitely eating fruit and vegetable as part of your diet will help a lot.
Thank you. And Cheri, how do we actually eat a plant-based diet and get enough fruit and vegetable servings? 5 to 9 servings is a lot, or sounds like a lot.
Sounds like a lot for sure. But if we really, take a look at what a half a cup of vegetables looks like, it's really kind of like that, just around the palm of our hand. So it's not very big, so that's a half a cup raw, trying to make a point of your snacks have fruits and vegetables in them. Every meal, as much as you can, has some vegetables or fruit incorporated into them, and it becomes a lot easier. You can replace some of the meats with legumes or lentils, which is then also considered plant-based as well. So you can add fruit to your salads with all of those veggie fixings. Add nice soups with lots of vegetables added to them. Just making a point of always making half of that plate be vegetables, a quarter be the whole grains, a quarter be protein, and that protein can be plant-based protein, So I think it's easier than we think sometimes.
Thank you. Can you tell us what legumes are for those who may not know?
Yeah, legumes would be black beans, pinto beans, chickpeas, any kind of beans of that kind. So all are good. They technically have some carb in them, but they have so much fiber in them that we typically can't eat much more than a half a cup of them at a serving anyway before our belly says, ooh, that's a lot. And we have to stop.
And I want to add a key point to that. Eating food in its most natural state actually helps with portion control.
Yes.
It makes us eat less and reduce our craving for simple processed food such as candies, chocolate.
Yes, very true, very true.
Yeah.
Mm-hmm. We get filled up when there's a lot of fiber on our plate, and it stays with us for a long time. If I add, some beans at lunchtime to my salad, I'm not even thinking about food till supper time. It just feels really satisfying.
Absolutely. Now, Dr. Lau, this comes up pretty frequently, I'm sure, for you, but what about sugars and fruits? We hear that sugars might be bad, and that might mean that fruits are bad. What do you think about that?
Yeah, that's an excellent question, and these are often asked in the clinic, especially for my patients with diabetes. So the short and simple answer is fruits are good, and they provide a lot of health benefits, as I mentioned earlier. The key takeaway point here is eating a healthy, balanced diet. So the portion matters. In general, especially for patients with diabetes, we recommend at least 2 to 3 servings of fruits, but try not to go overboard, not more than that. And of course, as patient with diabetes, you should be aware that fruits are carbohydrates. So if your doctors prescribe you insulin to be given for any carbohydrates that you eat, you should give yourself insulin appropriately for the amount of fruits you eat. I also want to add that fruits, you can get it in various forms. It doesn't have to be, you can get it in frozen state. You can also get it in canned fruit if you're busy. And the important thing is when you get a canned fruit, you always have to make sure that it doesn't have added sugar in it. It doesn't have, it's tight in its own juice and it's unsweetened. So those are keys.
One thing I would like to add about the frozen, we're kind of moving into a season when there's not a lot of fresh fruits available, and frozen are often flash froze, so they're very fresh. So sometimes they're a much better choice than berries that are coming from South America.
Yes, I want to add to that as well. Often, some studies have shown that sometimes frozen fruit has more nutrients than regular fruits because fruits that take time to transport in that process, sometimes it loses its own nutrients. Yeah. So yes, definitely frozen fruits are a really good option.
Thank you. Last, Cheri, how can we challenge ourselves to actually increase our fruit and veggie intake and make it sustainable?
Well, I think one of the first things that I would recommend doing is just kind of take a couple days and just kind of look and see how many fruits and vegetables are you getting in your day. And then challenge yourself. Maybe can you add a little bit more at breakfast for a while, or do you need to add some at lunchtime? And just keep working towards that 5 to 9 goal until you get there.
Thank you so much. All right, that concludes our clip for today. And next month, you'll learn more about the Simple Health Program. Thank you.